much. Basically, what I am going to try to do is to bring some examples from the health sector, but especially focus on some of the opportunities and barriers that I see if we respond to this issue of connectivity. And again, I am 100% on the idea of improving connectivity, but I think that there are things that we need to take into account also when looking at this topic. And I also think it's very different depending on the age cohort you're touching and depending on the level of skills that you have, what are the constraints that you will be facing. So let me first start with this idea that came from the WDR that the World Bank did. Basically, the core idea is that this access to these technologies could create inclusion, efficiency, and innovation. And inclusion because it reduces the search for information, so reduce the symmetry of information. It can make it automatic, which increases efficiency. And it can create innovation because you can create economies of scale. And also what we call network externalities, which is something very positive and can make it cost effective. In the case of health, the health sector, this can clearly be seen in different ways we can use e-health systems. So for example, we have the electronic health record, which is data searching information, managing information, laboratory information, pharmacy information, patient registration. But we also have improvement of efficiency through better monitoring, clinical decision support. And then we have also the innovation, which is these new methods of reminding the patients of taking their medication, telemedicine, research data, analysis of the data collected. All these have shown in different types of experiments a lot of success in what they have and how they have performed. But one of the things and also, for example, if we move to non-communicable diseases, which is a major problem in most of developing countries, like cancer, chronic respiratory diseases, diabetes, cardiovascular diseases, and other non-communicable diseases. Basically, they represent around they kill around 40 million people each year, which is equivalent to 70% of all deaths globally, according to WHO. And this is $170 billion cost to scale up action of WHO and around $7 trillion in terms of cumulative loss. So any improvement that we can do through any of these tools, of course, have the economic benefit. And that's where I think it's easily to make the financial case for the 10 billion or whatever is needed to be able to improve connectivity to reduce all these problems, given that we have a lot of concepts that have already been proven that work properly. Now, how this operates and where at least I see some of the complexities. So we can affect individuals in terms of the e-health. We can affect healthcare providers. We can affect governments and NGOs. And of course, the heterogeneity within each of the groups will vary depending on the level of development that you have. But clearly, the more you move up to the chain to the right, the more homogeneous you will find within that cell, and the bigger effects can have if, for example, you have a huge heterogeneity of education and nutrition in the case of individuals. But in the case of individuals, basically the objective is to enhance personal health and life quality, to improve access to healthcare services, less waiting time, and more autonomy in health management. But again, the impact of this will depend on the heterogeneity and how you reach those individuals and how you are able to access them. In the case of the health providers, I think that the creation of a public good of being able to access to other people to check on potential diagnostics and to reduce the need of health workforce is huge, because in many of these regions in Africa or in India, for example, there is a huge need of healthcare services. And by being able to have this through connectivity, I think, and given this group is more homogeneous, you increase hugely the possibility of giving access to it. So it's a way of a clear improvement that can help to get the benefits in all the diseases I mentioned before. In the case of governments, of course, you have the SDGs, the MDGs, and that could help to improve the situation and can help to facilitate their work on the delivery of these public services, which in many cases they don't have. For example, reducing of child mortality, improve maternal health, and combat HIV/AIDS, for example. And there are initiatives that came out and were used for the Ebola crisis, for example, that were extremely fast in terms of returning, in terms of the velocity in which they could deploy and which were extremely useful for that. Similar for the case of the NGOs, I think, again, with some heterogeneity, I think it's easier to provide information, and for them also to discriminate the information they want to use. And that's very important, because it could be that the content is not necessarily right, but if you have the capabilities to be able to discriminate quality, and you have enough options over which to choose, which could come from private sector or from different providers, then you're okay. You will choose what is good for you and what will give you the return. The problem is when you don't have too much of a choice, and that's where it could be that the content issue becomes more binding than what we know. Now, if we link this to the issue of connectivity, content, and capability that Joaquin was referring to, we know the technology which is the mostly spread is the technology of cellular phones, of course, and a lot of the internet is also linked through that. But the important thing that I want to raise here, and this is within countries in the continent of Africa, what are the major digital divide that we find even today in terms of individuals with internet access? No? So, for example, the bottom and the upper, the first two columns, show a significant gap in terms of income distribution, but also between mature and young populations. The significant gap, the younger populations had a lot more access. Rural-urban, again, a significant gap. And women and men, as it was mentioned before, there is a significant gap. And this also brings a problem of initial condition. No? You have differences at the initial level, which we thought, even, for example, if I look into cellulars, we thought that that was not the case. But when we look at data, household data, and here I just bring some countries as examples. I have a table of 20 countries, but just look at Peru, for example. Rural Peru, the penetration of cellular phone is 47.1, in urban is 82.2, in Bolivia, 18.7 and 77.6 in urban. Look at Bangladesh, for example, which was a surprise to me. The differences are enormous when we look at those countries. Despite, for example, you have the Grameen Bank. In India and in Africa, it's even bigger. So this gap, rural-urban, even in cellulars, still is huge. So how we can create innovation that will move us out and improve over that, I think is really important. And that's the connectivity question. But the connectivity question is linked to a price also. And the price is because of the institutionality and because of the regulatory mechanisms that Daniels was mentioning before. And this is basically looking at a basket of prepaid phones in standardizing on PPP dollars. And the heterogeneity of the cost of that same basket across countries is different. Even looking within one country, looking to Brazil and looking to the different income deciles, this is how much they can afford, according to the income distribution, this prepaid standardized basket. And you will see that only the higher quintiles are the ones that can really afford it, or the share of their expenditure they have to use. They can buy it because they find a lot of utility, but the share of their expenditure they have to pay for it is a lot bigger relative to of course, the higher income decile. So again, that creates an access, but that is a result of what is in place, of the structure of the market in place, and how you can regulate prices if needed to regulate if there is no perfect competition, which in this industry, mostly you are moving in an oligopoly market or close to a monopoly market. So the gap that we are observing in access is important. We have 6 billion without broadband, 4 billion without internet, 2 billion without mobile phones, and 0.4 billion without a digital signal. So again, here is how we break this, but to be able to break this, we need to realize that digital technologies tend to be productivity biased. So the more the income, the more the effect on productivity. It's skill biased. The more the skill, the more access you will have. And it's also voice bias in terms of institutionality. So this relationship between what I presented at the beginning, innovation, efficiency, and inclusion, is with these complements in the site, this level of institutionality that will allow you to realize all these benefits of the better connectivity. If you don't have those complements, these institutions in place, and basically the pricing will be too high, and so on and so forth, you will have barriers to entry and so on, then you could have concentration, you could have more inequality, and you could have more control. And that's what you want to avoid. So how we can do to resolve that issue, and I think that's the question. We can go through a traditional way, which is the traditional transition, improving regulation and so on and so forth, but we know that takes a lot of time. And for me, as it was mentioned before, this could be very destructive. So how we can create an innovation that is so simple enough that will allow us to resolve these traditional steps and will allow us to move fast into a process of connectivity that don't require all these mechanisms in place that sometimes are extremely complex to be done. And if we look at the data, this is the data between technology and complements, what we observe today is like high-income countries are on the top. They are the ones in the transforming area, but basically the lower-income countries are in the bottom. And that's conditional on those complements. This graph is showing on the vertical axis the complement, horizontal axis the level of technology access. So again, what we can do to skip and to jump those complements, I think is really important, and I think where the innovation could come in the way we can deploy this type of access of technology. In terms of the content, this is a very complex issue. Again, for me, it's more a competition for good quality content and to have enough choices over which, if you have the connectivity, of course, you can have access to it. We have done reviews in all these sectors. I have found very little on health in terms of real serious impact evaluations on the impacts. I have found a lot of reports of the use and so on and so forth. But again, the more robust is the impact evaluation, the more the issues that you could find. But at least in market information systems, extension services, very rare cases, you really see a significant impact. And in most of the cases, when you do the qualitative assessment, it's because of the quality of the use of the information. There are really good ideas in terms of applications on e-health services in Africa. This is just a few of them. There are many others. For example, the Just Tested, which was focused to look at HIV. For example, here, something which is a technology that we were trying to figure out. Sometimes you want to, if you want to move out people that are infected with HIV, you have to be neutral to the information. So the technology should be, for example, match mismatch. So if both of you match with HIV, without HIV, but you shouldn't release the private information. And that's a technological innovation on how to release that type of information rather than giving the result of the test. The MAMA of South Africa, which helps to keep records of mothers which are pregnant, and then ICTs, which is this system of information that they started in Uganda, but which also opened into the system that was used for the Ebola crisis. So there are many more systems, the text alert, the MOCHA, the mobile, many of them, but again, I think it's really important to look at it. But let me just finalize with a topic which I think is important and captures this issue of capability. This is a map showing the level of illiteracy. So can an SMS campaign work in Africa, for example, where we have this huge level of illiteracy, which is very different, as I mentioned before, to the case of Uruguay. If people cannot write and read, how do you expect them to be able to understand an SMS? And even if you look at many of the SMS messages today, they're pretty complex. No? If we want to look at weather alerts, they're complex, very difficult to understand. So how we can, again, jump over this constraint? Kids are a great option, I think, and that's, for me, that's the way to go, but it's important to be careful on how we can skip that constraint. So we have, I just want to briefly present 3 studies. One where we show how we can avoid this by looking kids to kids. So basically transferring information to kids directly and seeing if they make choices about that information. And that's basically going to a school in the northern part of Cajamarca where there was no internet at all. We brought internet to them, and it was amazing the velocity in which they learned how to use the computers. And then give them some information through the internet and see if they really adopt that type of information. Why? Because these were kids that have a nutrition problem. They had to walk 3 hours to the school because they would live very far. And most of them were with anemia. So just providing a simple solution of an iron pill and see if that created a change. So we were just using the computers and the internet as a mechanism to see how much they adopt. Once we were able to test if they adopt, then the next step was, okay, can they influence the behavior of the parents? Can I use the kids as the catalyzer to translate that information that I was providing through the computers and to teach that information to the parents? So as Antonio was mentioning, kids have a capacity to teach. And what we wanted to test, if this could happen in very concrete things of extension in agriculture. So in the case of the kids to kids, we use these videos, and the messenger here matter a lot. So we tested with videos of the health center person, the municipality leader, and a soccer player. The content was exactly the same. The messenger was different, but the content was exact. And what we found is that because people told us, the kids told us that they admire soccer players, that the message of the soccer player created a huge spillover relative to the others. But not only that the kids reduce their anemia rate, and as a result, they have better cognitive results. So imagine if I just provided the computers to them, because of the anemia, they won't be able to be attentive to math and to whatever was taught to them in the computers, and that created a problem for them to learning. But because of this message that reduced anemia, they were more alert, and that improved the cognitive ability and improved the grades. And just, this is basically the distribution of the curves. This is a randomized trial within the schools in Peru, and basically what you can see is the shift of the blue line relative to the red line, showing that there was a positive impact in terms of the improvement of anemia, and that resulted in better grades. So the next step was kids to parents, and we did it without ICTs and with ICTs. Without ICTs was basically in the traditional way, but giving good content in terms of how to reduce the probability of getting infected through leukocytosis. And we did it with ICTs. And the idea of the ICTs was this upward intergenerational mobility to parents, and see if that worked. I knew that I could influence the behavior of kids. What I wanted to know is how much I could influence the behavior of parents. So basically, we went to the plots of the kids, we identified problems, and we give them very simple solutions through videos to the kids in a randomized way to assure causality, and then we test how much that information was reached by the parents and how much the teachers were able to teach. These are the types of videos. This is for the fall corn armyworm, which is a common problem, very simple to resolve, a molasses trap, any kid can do it, but they can also teach their parents how to do it. Extensionists have failed massively in resolving this problem. It's all around in Africa, it's around in Latin America, in Central America. And what we found was that the implementation of the experiment, when the student is taught in agricultural practices, the farm manager, so the parent that practice, increase the use of that practice in between 20 to 30%. And not only that, adopts the solution between 16 to 23%. So a very small intervention in the school created a significant impact, which we thought was very important. Because at the end of the line, what this is telling us is jumping this constraint of capability, working through the kids, and using the upward intergenerational mobility, which psychology and marketing has used a lot. In economics, we have done very little on this. And basically, it was showing a causal effect of the potential impact. So just to finalize and to keep my time, what I am trying to say is that we need still a lot of innovation to be able to go around the problem and not to go through the standard procedure to be effective and move fast. The three C's are important, but we need to carefully move in parallel. I don't think it's sequential. And I think the way to move in parallel is to provide enough supply of that information or different ways of content so that people can have a choice over it and pick what is better for them. We have still an access gap, and again, if we can jump the problem of capability through kids as messenger, I think that could be a very useful mechanism. Thank you.